Hi, Don here. Welcome to Podiatry Practice Mastery. I'm going to go over the $1 million minute. This is kind of what I'm doing to get my practice to the $1 million mark and beyond. Hopefully it's beneficial. This will be a recap of a Thursday. So I had 24 appointments, no open slots, and just so everyone knows, my slots are 20-minute slots. I do 3 per hour. I work from 8 until 4. Last patient is 4 o'clock, and I do take usually an hour for lunch. I don't think I ever get an hour for lunch, but it's in my schedule. So the first patient was a 61-year-old female, was for an orthotic follow-up. She had some peroneal tendinitis. She was feeling better with the orthotics, and I recommended getting x-rays to look at her foot and also foam rolling for the back of for the side for the peroneals. She does not need a follow-up. Another patient was a new patient, 75-year-old female. She had bunions and hammer toes. We got x-rays. So as I've mentioned before, my staff automatically gets x-rays on everyone. I reviewed those, talked about anatomic shoes, spacers, things like that, and she's not going to have a follow-up, just follow-up as needed. Another patient was a 73-year-old female, male, came in for nail fungus. So this was Lamisil number 1. So I reviewed the nail sample and I ordered the Lamisil and the LFTs, and they got the package, the UV light and the biotin. Actually, this is one of my frustrations of the day. We ran out of biotin, and we've been running out of things in the office, and I think I've vented before. That's not a good thing. And so I told my manager we need to figure out a process of checking things so we don't run out of stuff. If you have any great ways of not running out of stuff, let me know. But basically, some days we do more cam boots, do more bite, and do more things. So we have to have a level that we keep in the office so we don't run out. Next patient was a 65-year-old gentleman. He had some neuropathy, nerve issue, and I prescribed him gabapentin. That gave me the medication management, and I also want to check on Q10s if that would be covered. I think that would benefit him. He's going to come back in 3 months to see how the gabapentin is doing. Another patient was a 37-year-old man. He had a IND on the left hallux, and he had a wart on the right. So he had a wart, and he had a infected toenail. So for the wart, I did cantharidin, and I'm going to see him in a month. I'm tending to see my cantharidins once a month. My warts, I guess if I was starting out, I'd probably see him more frequently to kind of fill up the day. Patient came back. This was a patient. He had a sliver due to a piece of hair. He's a barber, and he had a hair sliver. And I saw him a couple weeks ago, and it got better. I was thinking this is probably one I probably didn't need to see back. This was a low-level visit. I probably could have told him to come back as needed to save that low-level visit or put someone else that's more valuable in there. This is another patient. He came back, 64-year-old man. He's follow-up after plantar fasciitis and 3 shockwave sessions. He is fully better. I do a 6-week follow-up. He's better. He doesn't need to follow up with me. Just once a year for his orthotics. I'm going to see Barbara. This was another patient, 66-year-old female. She had routine care. She had porokeratoma, so I did lesion destruction on that, and she did a nail sample, possibly to treat her nail fungus. I'm going to see her back in 3 weeks. Another patient was a 57-year-old female. She did EPAT number 3. She had pain on the upper lateral leg, like the pes anserinus area, and I did a shockwave 3 sessions, and she is feeling so much better. I'm going to see her back in 2 months for a follow-up. She is not doing physical therapy. I saw a 71-year-old man. He had an ingrown toenail, and I also did his nails. He'll come back as needed. Another patient came back in. Another new patient, 66-year-old man. He had a cavus foot, and he had kind of an interesting thing. This guy, I think he's a little neurotic, and he's picking his nails, and he had no hallux nails. I guess he had maybe a fungus in the past, but I couldn't see anything because he had been picking them. But he had a cavus foot, so we did an orthotic for him. Another patient came in. This was a 65-year-old female. She came in. She works actually at a local primary care doctor. So I did an ultrasound for her, and I showed her one foot compared to another. She had the effusion there with the plantar fascia, and we did shockwave number 1. And this one, I gave a little deal to, just because she's a referring provider office manager, so I gave her 50% off. I was feeling generous. Also, this other orthotic guy, I give a discount for that. So once in a while, depending if they're referral sources or referred from someone, I might give them a little discount. Another patient came in. 73-year-old female. She's from she had a matrix bilaterally because she had chronic ingrown toenails. Another patient came in for Swift. This was number 5, and I'm going to see this patient back. So this was a 3-month follow-up after the 4 sessions of Swift, and it wasn't totally better, so I did Swift and Cantharidin. So I doubled them up, and I'm going to see her back in another 2 months. Another patient here, this was a 70-year-old man. He had a previous Achilles rupture. He was doing really fine, but he did a lot of yard work, and that ended up really aggravating everything, very swollen. I think the swelling was a problem. It's hard to get on compression socks, so I'm going to actually have him fit for a custom AFO. That does a really good job at reducing the swelling, but I think it'll help stabilize his ankle and his Achilles. Another patient came in, 54-year-old, for a left hallux fungus. Did a nail sample, see them back in 3 weeks. Another patient came in, a 62-year-old man. He had a left 5th met porokeratoma, and I had treated it a couple times before, and so I decided, this was a friend of mine who recommended this, one of the other docs, who I really respect. He recommended doing a lesion excision. So I'm starting to, or I've done it twice, not starting to, but I've done it twice, do 2 millimeter punch biopsies, so a lesion excision less than 5 millimeters for these porokeratomas with Lido with epi to see how they turn out. So I'm trying it out. We'll see if they actually come back or not. I was doing silinocaine with carving it out with my 15 blade. We'll try this new way. Another patient came in, EPAD follow-up, doing much better. Another patient, this was a 54-year-old, hasn't been there for quite a few years. He came in, had a sore on his left foot, and he had a hammer toe, got x-rays for the sore. I just recommended proper anatomic shoes. Another patient came in, came in for a ulcer to the distal tip. He was recently hospitalized. It has a dry eschar, but on the x-ray it showed osteomyelitis, so he's going to be set up for a distal amputation of the hallux. Another patient came in for, he was a lesion destruction. He was here for a porokeratoma in the past, and it's almost gone, so I don't need to see him back. Another patient came in, 25-year-old man, and he's like a diesel mechanic, and he had 2 warts, and he wanted them out, and so I did excise them. So this is kind of, at the end of the day, this is kind of the bad thing, because I had to numb them up. I used Lido with epi, or a 50-50 mixture of Lido with epi with regular lidocaine. And the only reason is because I have like these little vials of Lido with epi, so they're kind of a pain to drop, so that's why I mix it. And then I anesthetized him, removed them. He's going to come back in 3 weeks. And he did not want like lengthy treatments. That's why I did that. Finally, the last patient was an ultrasound that showed an effusion around the Achilles tendon at the insertion, and I did session 1 of the shockwave. So the way I'm explaining shockwave now is I'd say that most likely if you've had pain for over 6 months, you're going to need 6 sessions of shockwave. But we're going to start out scheduling the first 3, and then we'll do the other 3 afterwards. A couple of things I'm kind of excited about. I think I told you about buying skills. I am going to get coached with another person to help me with my shockwave, and another person to help with kind of like my e-newsletter. So I would really love is a kind of an orthotic coach. If you know anyone I can pay that would help coach me to either do more orthotics or explain them better, or I don't really see that exists in our realm. But if you know anyone, let me know. Have them reach out to me, or reach out to me and tell me. I would love to know that. Or if you are really great and you want to coach me, I'd love to kind of learn from others. Okay? Okay, thanks guys. Have a good day.